Hello everyone. This video describes my agent-based epidemic simulation. I wanted to understand the dynamics of the COVID-19 pandemic and, like most, was interested in the question, what does actually help? In order to find my own answer, I started to program a virtual population and made my own agent-based epidemic model. With an agent-based epidemic model, one can investigate the dynamic of an epidemic spread and derive the count of infected, recovered and deceased persons. How does an agent-based simulation work? Well, first they simulate agents. Agents can have different properties like gender or age. They could be workers, pupils or keeping the house. The totality of all agents is called the population. One can represent the population as a graph. In this graph each agent is represented by a node. Agents that live in the same household are depicted close to each other in the graph. If agents interact with each other in ways that could lead to the transmission of the virus, a connection or edge is drawn between them. Since the persons an agent interacts with change over time, the pattern of edges change as well. Finally, the color of an agent indicates its health state. Healthy and susceptible agents are represented by blue nodes. Infected agents are red, they are drawn green, if they are recovered. They are black, in case they died. In order to approximate the real epidemic spread, the virtual population needs to be big. Here you can see an example with 2,000 agents. This is an example of a situation with few contacts. But the contacts can also be much more intense and involve many agents. If the number of agents is further increased, then visualization becomes less and less helpful. But the mechanics of the large population stay the same. Now, how do the agents interact with each other? An agent can spend his time on different activities. Sometimes the activity is related to his properties. For example, workers go to work and have contact to their colleagues during working times, while pupils attend their classes and have contact to their classmates at the same time period. But there are also more or less random contacts. For instance, if people use public transportation or go for shopping at the weekend. The agents in the simulation follow a fixed weekly time schedule, unless they get ill. This weekly time schedule is shown here. It represents a 5-workday week. In the morning and evening, there is some family time included. On 2 days per week, there are club activities. These are regular meetings with teammates for training, for example. On other days agents might meet some of their friends. In the weekend there is some shopping time as well as meeting other relatives that do not live in the same household. Depending on the activity, different groups of agents might interact with each other. During any contact, there is a certain chance that an infected agent transmits the virus to other agents. Each simulated disease needs to be characterized as well. As the model simulates COVID-19, I used estimates published in literature. Among the required properties are the probability of transmission, the incubation period, the start and end time, where an infected person could infect others, the duration between infection and onset of symptoms, the probability to become a severe case, the potential need for intensive care, the fatality rate, and the duration to recover from the disease. Here you can see some examples of the cumulative probabilities as functions of time. With all these aspects being modeled, one can run the simulation. Here a run with a small population is shown. First, there is just one infected agent. During nighttime, there is little contact between the agents. During the day, there is a very dense network of contacts between the children with their classmates, the workers with their colleagues, the housekeepers with other persons that they might meet when they shop something. So slowly more agents become infected, and when we speed the simulation up, we can see that the count of susceptible persons starts to decrease and the number of ill agents increases. Now, as this population is fairly small, The exponential growth of the infection count cannot take place over a longer period, and thus the number of new infections decreases. Finally, the number of recovered agents overtakes the infected ones and the epidemic approaches its end. With larger populations, the exponential growth can continue much longer. Here is a comparison between actual infection numbers of Germany in February and March 2020 and some large population simulation results. Now one might be interested in the mechanisms that are accountable for the majority of infections. Some figures were published by the RKI in Germany. The simulation shows some similarity. Another important question is, who would possibly die during the epidemic? Here you can see a comparison between the agent simulation and numbers published by the German Federal Bureau of Statistics. Again, some comparability is given. So, what is this good for? With an agent-based epidemic model, one can predict future trends of infections numbers. But maybe even more relevant is the insight in the transmission mechanisms. These can be used to estimate the impact of measures like banning public events, closing schools, closing stores and so on. But this might be covered in a separate video. I hope this video explained a little bit how the simulation works and was interesting. For a more detailed description, you can read my article about the model. The link is given below. Thank you for your attention and stay healthy.